The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your calls on virtually anything you'd like to talk about, as long as it has your health as the foremost. Well, here's an opportunity. No drugs, no surgery. What can you do? 888-630-9625. That's 888-630-9625. Let's talk about your stuff, but we have a topic, and we're going to lift the veil, so to speak, on something that is very important. Have you ever had that experience where your brain just isn't working the way it's supposed to? It's called brain fog. You're just like, I can't get through this stuff, don't know what's going on. There's this veil that seems to be in front of you, so you can't connect, you can't attach to reality. Well, there's a lot of reasons for that. And I had that experience this morning, actually. I got up very early. I was in Philadelphia for a 3-day meeting, and I had to leave Philly at 8 o'clock this morning so I could get down here to do the radio program. And it was like very early, and Sundays I allow myself at least another hour to kind of linger a little bit. And my brain all the way through was not functioning, and I'm drinking water and drinking some tea and doing things to try to wake up, and it took me a while. But how about when you're like that all the time? When you're there constantly and you can never connect and you're always in a bad place? Well, we're going to talk about brain fog. We're going to talk about not only what it is and how it is, but how do you get rid of it? How to lift the veil, which is going to be the topic of our program at the Roselle Center for Healing this Wednesday, October the 24th, 7 p.m. And who else might be better than lifting the brain fog other than Dr. Qinglong Zhang?
Hello, Dr. Zhang.
Hello, my friend. Glad you're back with me again.
Thank you.
The last time I was really brain fogged is when I went to China.
Oh, really?
And, I got there. It's like every time you go west, and even though it's west halfway around the world, I got there. It took me 2-3 days before my head cleared up, before I could think I could function.
Yeah, jet lag, different environment.
It's not okay.
Yeah, no,
it's not a good thing. You have to fix me because I can't afford it. So seriously, though, all kidding aside, this Wednesday evening, October 24th, you're going to be talking about brain fog, but more importantly, how people can get rid of it, because in many cases, brain fog is a sign, is a symptom of something much more serious than just kind of not being focused. Let's talk a little bit about it. Let's talk about, what brain fog really is.
Yeah, before I talk about the brain fog, so I want to clear, so probably a lot of people don't know what exactly brain fog. So sometimes you have this problem, so what's that? But you don't know it is brain fog already. So before I get there, I want some questions. You can pull out a paper and say yes or no about 4 questions. So the first question, do you have any experience when you walk into a room, you don't remember why I'm here or why I'm there? Oh, why I'm here? The first question.
My wife says I do that all the time.
Okay. Okay. The second question is, that's one. Do you have any? Is this kind of experience? You want to recall some name, friend's name, or the very familiar the name, but however you can't. So what's the name? Oh my God, I cannot recall that.
Okay, that's number 2.
Number 2, yeah. Number 3 is when you go to somewhere else, you want to bring the key. You do a lot of stuff at the same time, but you forgot where you put the key. Possibly you put it in fridge, but do you know where's that?
As long as you don't open the refrigerator, it's not where the vegetables are.
Okay, number 4 is the first question is you want to tell somebody something, but suddenly you forgot about that. So, oh my gosh, I don't know what I want to tell you now. So this is 4 questions I want to ask you. If you see, yes, probably most people have a yes for all of them, probably 2 or 3 of them. If you have this kind of issue, similar issue, that means you have brain fog.
So let me clarify this, because there's a lot of people out there that are going to listen to this program, and they're going to go over those 4 things that you just said are about brain fog, and they're going to go, yes, 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 yes. And for some people it comes and goes, and some people it's stuck, it's permanent.
Yeah.
But they can be things that can be that are very minor, or they can be signs of things that be quite significant.
Yeah, once in a while, just like you today, you went to Philadelphia, you come back, and you don't have enough sleep. Once in a while, it's okay. But you have it very often, 3 times a week or 4 times a week. It is not normal. It's a very big concern. Once in a while, everybody have this kind of issue happen, but however, it depends how frequently you have this problem. So most of the time, I have this most of the time. I forgot where's my cane, but 3 times this week. I forgot, this kind of issue. So when I walk in that room, I don't know why I'm there. It's just 3 or 4 times. This is not normal.
So does it count that if you walk in and you call your wife a different name other than her name, or is that something very different?
Big trouble.
Oh, okay.
Okay.
Just asking.
So yeah, so then we got the brain fog here. So actually, brain fog is not a medical diagnosis. If you went to any doctors or medical doctor or whatever this kind of doctor or chiropractor, there's nobody tell you, okay, your diagnosis is brain fog. Actually, brain fog is a clinical term. It's rather symptoms, and it's not a medical conditions. That means a lot of issue underneath the brain fog can cause that problem. Okay,
but brain fog also is a symptom of somebody who is just being flat out tired all the time. As they begin to work with it, we've lovingly talked about something called the HPA axis, which is hypothalamus pituitary adrenal.
Yep.
And with that adrenal system starts getting beat up and, so to speak, get kicked in the pants because we're pushing, we don't sleep. Particularly in this area, in the metropolitan Washington, D.C. area, people are on super juice. I mean, to stay awake. I mean, they're drinking coffee, they're drinking 5-hour energy drinks. They're trying to do everything that they can, with the exception of restore function to their normal body physiology so they can clear this up. But the end piece is that they're always walking around like they're half asleep.
Yes.
And their brain's not clear.
Yes. It's totally crazy. So brain fog is not only body feel okay, it's cloudy in the brain, but also it's kind of the dysfunction, the brain dysfunction is a lot of general the symptoms. You probably have memory problem. You have the shorter recall problem. You have a hard time to focus something, and you have a hard time to concentrate something. This is all general information, all called brain fog. So brain fog is not only one symptom; it's kind of the symptoms group. A symptom group.
But that symptom group has to be distinguished, whether it's pathological or whether it's functional. Functional meaning because of lifestyle and things. But the problem is, brain fog can lead to something much more serious over time, correct?
Yeah, that's right. Remember, we held the lecture before. It's a very popular lecture. It's called Warning Signs, Body Signals. We talk a little bit about this. So everything, the body give you some signs, and the body tell you it's time to focus the body to find what's the reason, what is underneath the cause. Then we can clear out and fix the brain fog. So brain fog is easy, it's hard. It's easy if you found the reason or the cause, it's easy to fix that. It's hard is why a lot of people have brain fog, go to a lot of medical doctors there, prescribe a lot of prescription, medication, they still didn't get it out because they don't know the reason.
When your brain starts being, I'll use the term scrambled. It's like there's a lot of things that are going on, but you can't focus on a very specific item or intention. That's not necessarily brain fog, is that correct?
Yes.
Okay, so when we have brain fog, it's to define the definition is simply when your body is at a place of physiological slowness, if you will, or suppression that now you can't adapt to your environment, your circumstances. But ultimately, if it stays that way long enough, you start getting changes in neurochemistry, you start getting changes in brain tissue, neurological communication to the rest of the system, and so forth.
Yes, that's totally true. So also, actually, this kind of brain fog is also brain dysfunction. Brain dysfunction is kind of brain inflammation. Brain inflammation, I will talk a little bit more later. So brain inflammation is a new word, and then it can cause a lot of problems. It can cause the brain chemistry change. For example, it's serotonin. So serotonin, probably a lot of people are familiar with about this. Serotonin has a very, very positive effects on your calming down or positive mode. Also, another is brain inflammation can affect another chemical, is dopamine. Dopamine is supposed to let you enjoy the life. So speaking of dopamine is very interesting. A few weeks ago, I went to a seminar to learn about brain chemistry, this kind of issue, things. And then there's a teacher talk about the dopamine stuff. Okay, the dopamine is supposed to let you feel very useful, very worthful. And then I give an example that his friends is a lobbyist. So he did a very good job. It shows a very, very good. So that everybody think this body is so positive. This guy is so good, so nice. However, this guy get a suicide after 3 months. 3 months he met that guy probably last year somewhere, sometime.
And he committed suicide.
Suicide. Definitely suicide.
So you're saying that the dopamine levels were not adequate?
No, because that guy, what happened is that guy, they have very bad diet, a very terrible diet, poor diet, a very terrible, exercise, the habit, whatever is kind of issue. I will talk more about that. So they said, okay, that guy lack of dopamine. So that guy feel very, very useless. Worthless, and when you go back home in front of people, say, okay, I can do that, blah 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 blah. When they go back home, it's worthless. Why I'm here? Why I'm in this world? No purpose at all.
Dopamine is the one neurotransmitter in the body that allows you to have. You can self-acknowledge the fact that you have worthiness in the things that you do. It acknowledges that the path that you've taken is one that is moving you forward.
Yep.
And unfortunately, there's so many people that get into a place of despair, get into a place of depression. Mm-hmm. And the truth of it is, if you study dopamine and you did a biochemistry analysis on the neurotransmitters, you would find not only that it's low in many of these people, but also it is out of sync, and it can come about because of, as you said a little while ago, dietary balances, because the majority of neurotransmission is in the intestinal tract.
Yes.
And when you're eating things that are bad, the gut's not working the way it's supposed to, so you're not producing the neurotransmitters the way they're supposed to produce.
Yeah, this is why I always tell my patient, okay, be careful your gut. The gut is the second brain. The gut is second brain because it's over 85% the neurotransmitter meeting the gut and goes to brain. Brain let it function very well. Okay, so overall, so we talk about the brain fog. Brain fog is kind of brain inflammation, and brain inflammation can mess up the chemicals in the brain and to mess up a lot of issues.
We're talking about brain fog and the underlying causes, the triggering mechanisms, what happens, how that shows up. But more importantly, as we get into the program, we're going to be talking about how you can fix it. This Wednesday evening, the 24th, 7 p.m. at the Roselle Center for Healing in Fairfax, Dr. Qinglong Zhang, my very wonderful guest, because I learned so much about all kinds of things from this man from a very different platform. Give us a call here, 888-630-9625. That's 888-630-9625. If you'd like to register for the class, very simply, go to rosellecare.com. That's ROSELLECARE.com. rosellecare.com, and scroll down. You'll see the program. Hit the button and register for the class, and we're delighted to have you, and this man will walk you through it like you have no idea. We'll be right back. Don't go away. Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle live. Baby, it's cold outside. The weather has dropped. I think winter is going to creep in, and better be careful. Might even snow this year. I'm used to it, having grown up in western New York State. We went to school with 13 inches. I know, back in the day when the dinosaurs ruled the earth. But nevertheless, it's getting colder. You got to warm up. 888-630-9625. That's how you find us here. And Dr. Qinglong Zhang is my guest, and he's talking about brain fog and how to lift the veil, how to get your brain back, how to make it work again. But more importantly, you need to know what the triggering mechanisms are, and that's what we're trying to go over today. This Wednesday evening, 7 p.m. at the Roselle Center for Healing, he's going to be doing just that. He's going to go over this in detail and give you some options on how to reverse this thing and how to get your life back. So much of this is, in fact, the ability to change things that you have control over before they get to the place where they cause damage. And this can cause damage. We talked a little bit about neurotransmission and how that is affected. We'll get more into that in just a little bit. But before we do that, I do want to go to the phones. Marion, thank you for calling. How can I help you?
Oh, hi. Good afternoon. I wanted to know, which I guess a lot of people do, about the new polio-like virus. I don't know if it's a virus that's come up, and you can't find out any information in the newspaper anymore, nor on the TV screen, and it's a mystery, and it's of concern.
It should be. It's called the AFM virus, right? For short, and it's something that has been around for a long time, and it's something that shows up, but it doesn't have a tremendous amount of widespread contagious application. It is not transmissible from person to person.
Oh, I thought it was. That was one of my concerns.
No.
If it's contagious.
No, it can be. One person to another may be spread by a mosquito or a flea or some other thing like that, depending on which virus they're talking about. And it's a multidimensional virus. It's not just a singular type of thing. As we, been told on news media and scaring the heck out of everybody, is that it's sudden, and then you end up with weakness in the limbs, you lose muscle control. It's not fun, and particularly when it hits younger people, they can go into respiratory failure and so forth. So the paralysis that takes place is real. The fortunate part about this is it is not as prevalent as everybody wants to make it look like. It's again, you brought it up. It's a polio-like presentation, but it's a non-polio. It's called an enterovirus, by the way.
Yeah, what was upsetting is that they said it was rare and very new, and they didn't know how it spread from Minnesota to 22 states as of a week ago. I don't know how many states now.
No, that's not necessarily true, like many other things that are put out there that are half-baked and half-true. It's a strain of a respiratory virus, and once it hits that respiratory system, you have some problems. You have over 200 different viruses that you've been exposed to in your lifetime, and a lot of them are just linked into your genetic map, your DNA. And the reason that they ultimately have the ability to lock in and cause symptoms is because your immune system has crashed. So we're seeing more and more people with more susceptibilities today simply because of the fact that they're not eating the way they're supposed to. They never go outside. Their vitamin D level is very low. They eat so much sugar that, they're being susceptible to all kinds of things. As we said, 1 teaspoon of sugar decreases your white blood cell activity level, the ability for it to work, by 8% for 12 hours. And if you look at that and you have any kind of virus or bacterial pattern or fungus or mold that comes by, and you're exposed to it, and you've got a sugar tooth, a sweet tooth, you got a good shot of having that kick in. So if you want to keep the viral patterns under control, and I'm including the flu on this. I'm going to segue a little bit into what you're talking about. You have to make sure that you keep your ascorbate, your vitamin C levels high. You take things like echinacea. You increase your zinc levels. Get rid of the sugars out of your diet. Get a little bit of exercise. Keep your vitamin D levels adequate and high, and those should be tested at least once a year by everybody so you know where they're at. We're cave dwellers. We don't go outside anymore. And to that extent, we're weakening our immunological responses to all kinds of things. But the symptoms of this polio-like virus, it's also called EVD68. I'm pulling up the CDC website right now. And, its symptoms are very common in their representation. It looks like a cold, but you don't have to get the problem. You're going to have viral pattern after viral pattern after viral pattern that's going to expose. But the truth of it is, in this particular situation, the prevalence of it is very low. It's not a major pandemic. And we have to be sure that we take care of ourselves against other types of retroviruses as well. So the short answer is this: it's not human to human contagious. It comes from other situations. So bone up on taking care of your body for all viruses, as I had mentioned earlier. Lots of water, get out and walk, a little bit of exercise, get rid of the sugars, because that's our number one nemesis. We're coming up to a break. My guest in studio, Dr. Qinglong Zhang, and we're talking about the brain fog.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. I'm in studio. It's cold outside, so I'm going to stay in studio. It's really not a pleasant day, except it's really beautiful. 888-630-9625. That's 888-630-9625. Love to talk to you. My guest in studio today, Dr. Qinglong Zhang. We're talking about a very interesting topic, and one that many of us suffer from day to day. And some of us, unfortunately, it never goes away. Mm-hmm. And it's called brain fog. And this Wednesday evening, the 24th of this month already, Dr. Qinglong Zhang is going to present an evening on how to lift that stupid veil of the brain fog, how to get your life back, how to get you, instead of going in the refrigerator and, finding your keys that you lost 2 days ago. No, seriously, this can be something that can lead to a problem. When we think about things like that, Dr. Zhang, we're talking about people who have Alzheimer's, dementia problems and so forth.
MS.
Is this the same type of regression, or is this something that's different?
It's kind of the same. It's the same. It's actually brain fog is very common in Alzheimer's and dementia, or actually fibromyalgia. Actually, it's a lot. Just like I told you before, brain fog is not a medical diagnosis. It is a clinical term. It's a lot of their medical condition can cause that problem. And for Alzheimer's, dementia, this kind of brain dysfunction, brain fog is very, very common. So also same thing, this is all because of the brain inflammation there. Okay, so we talk about this kind of reason. So we will talk about some reason about underneath that behind of the brain fog. But Dr. I remember many times you talk about the concussion, the brain, the head injury. So,
when you're dealing with head injuries, and we've had several seminars on it, and we've talked about being able to analyze, the different platforms of the brain, doing a very simple test. And it's a fingerprint test, and it tells us the inflammatory markers. It's not a diagnostic test, but it's a prognostic test. And but in brain fog, you can begin to distinguish whether or not it is something that is due to a repetitive fatigue pattern that ultimately can lead into something serious.
Yes.
Or it's something that is already serious that presents itself with this characteristic symptom of brain fog.
Right. That's not a question. Remind me. I also ask my patient the question. A patient is, if the patient complains that they're fatigue or tired, I always ask my patient, say, okay, so what time you feel tired? So do you feel tired in the morning, or do you feel tired at the end of the day? If you feel tired in the morning, you're supposed to feel very energized, but you feel very tired. It's not right. There's something going on there. If you feel a little bit tired at the end of the day, we will say possibly you work too much, you have a lot of work to do, overstress yourself. That is normal response. But you're not supposed to feel tired in the morning.
No, but at nighttime what happens is people push through that tiredness. They go get another cup of coffee. They take something to keep themselves awake. They work more.
That's the reason, too.
And then they wake up in the morning and they're tired because they're not getting the sleep that they need to get. And that's a huge problem with society.
Yes.
Is that we're not getting the sleep cycles that are normal and are necessary and healing for our bodies to begin to recover and to be able to produce certain things. So, here's the situation. Brain fog is a symptom. And it can be a symptom of a lot of different things, but it can be a prodromal, if you will, a lead-in to things that are much more serious. And when we ignore that or we continue to push through, I was kidding earlier in the beginning of the program, and I said, I always feel brain dead when I go to Asia or I'm teaching overseas and so forth, and it takes me, I used to be able to snap out of it very quickly. But then you get into, other pieces of the puzzle. There's things like melatonin. As we get older, our body stops producing the levels of melatonin that we need to reset sleep cycles. So if we don't sleep, we're going to wake up brain dead, if you will, foggy. Our brain's not going to be able to function at normal levels. But if we push through that, that's where we get in trouble. If we don't stop, and then we start showing other characteristics, other symptoms of disease processes, that now we're in trouble. We've got to be able to shift early on and identify. So this Wednesday evening, seriously, if you've ever had that feeling where you're not present, you're not in immediate control of your thought process. The head starts shifting all over, but there's this veil, and that's why we termed this program brain fog, lifting the veil. It's important to understand that that's telling you you're not doing something the way it should be done, or your body is not processing the way it's supposed to. But we get into trauma and blows and injuries, and we don't think about I just bumped my head. But you bump your head, and then you bump your head again, and then you compound that onto stress patterns, or you compound that onto bad dietary patterns, and now you have a major issue. Give us a call, 888-630-9625. Dr. Zhang, let's talk about what happens over a period of time as you neglect this. How does it begin to manifest? I led into that a little bit, but I really want you to touch it. What happens when the head continues to be foggy, and we don't move into the direction of clearing it?
Yeah, so what happened is the same thing. We want to find the cause. We want to know what caused that brain fog. If you cannot find the cause, and that brain fog keep going. For example, you have some sleep issue. So just like I said, you drink coffee at night. You have very bad habit, but you don't think which you don't think so. You think it's good. You sleep about 3 hours. A lot of people stay up very late at night, and also they don't have enough sleep at night, and they feel very tired in the morning. And also the doctor said, okay, you really. So some people said, okay, if I don't sleep at night, I can make up in the day. So actually, it's totally wrong. You cannot make up the sleep at night in a day, even though 4 hours in the 1 hour. So it's very, very total. From Chinese medicine, so I always because I have my Chinese medicine education and practice in China for 11 years, I always combine these two together to analyze what's going on there. So if you keep letting the brain fog going from Chinese medicine, you'll destroy your kidney.
Your kidney.
Your kidney.
So your kidneys will pathologically stop functioning the way they're supposed to because of brain fog.
Brain fog is the most common symptoms of the kidney dysfunction. It's very interesting.
So you better start explaining to our listeners.
Oh, yes.
Okay, because otherwise I'll do it for you. But
from Chinese medicine, we talk about their organ, we talk channels. The kidney is the foundation of the body, so it's genetic foundation. So kidney can hold the energy, can hold the qi and the life force, and the liver is pump out the energy and pump out the life force. However, if you don't have enough energy in your kidney, and then your brain cannot get tonified. The brain don't have enough nutrient, don't have enough energy to function. Then you get a brain fog. It's from another medicine to explain what is hard word or why you get the brain fog.
So let me make it real simple for our listeners so they can. There's many different reasons why you're talking about it. I was hoping that you were going to touch upon that. Kidney is, in Chinese medicine, it's the life force of the body. In the Western society, we call it the body's constitution, the internal strength of how the body works. So we're just exchanging words for something that means the same thing. But here's the situation. So if the kidney energy is depleted, or we start seeing kidney damage or trauma, one of the reasons in our society that causes that, and it's very straight across the board, are people who are dehydrated. They don't drink enough water. So they're not flushing the toxins out. They're not clearing the kidneys. Kidneys build up with a lot of poisons and so forth, and even kidney stones and debris and so forth.
Yes.
And those, from a Western point of view, those toxic elements that can't get out of the body make us feel extremely sluggish, tired. i.e. brain fog.
Yes.
Right?
Yes. Also, speaking of dehydration, also water makes up of the 73 of the brain. The brain has a lot of water there.
So 73% of the brain
yes.
is water.
It's water, yes. Yes.
I have a comment, but I'm going to keep it to myself.
Yes.
There's a few people that I'd like to use that analogy with, but I won't do it. So 73% of the capacity of the brain is water.
Is water, yes.
And without water, we know that anything that's electrical can't function properly, and we know that the brain is electrical.
Yeah, it is another way to explain why the kidney problem can cause brain fog. Brain fog can keep going to destroy your kidney.
So what do you tell a patient when you tell them, you're dehydrated, you're not drinking enough water, and they say, but I drink tea or coffee all day long. Isn't that liquid?
It's a liquid, but however, I don't recommend you drink coffee. No coffee.
Why?
Why? Because coffee can, remember we talked about the serotonin, dopamine, and this brain chemistry. The caffeine can lower down the serotonin and lower down the dopamine and increase the cortisol. The cortisol, the stress, cortisol is a lot of cortisol, yes. The stress can cause the cortisol to go up and it can fly and fight. Your body your body in the status like always in the fight and flighting. Your body cannot relax. There's a lot of people, we come to our clinic and said, okay, I have stress, I have spine pain and neck pain and lower back pain. Because there's stress, the tension takes a muscle pull out the vertebrae, cause misalignment.
So which I'm going to go back to something you said earlier. Okay?
Yes.
Because you said that, which we know, dopamine, if it's inadequate levels of dopamine, you're going to feel depressed.
You feel worthless.
You don't have no value.
No value.
There's no value. So the more coffee you drink, the less worth you're going to have.
I think so. Yes, it's here. Yes.
So all you coffee drinkers out there, you want to start having some.
I get in trouble.
You want to start having some value about who you are. Give up the coffee and start drinking water.
And green tea.
And green tea.
Yes, there you go.
Green tea is very alkalizing.
Yeah, actually WHO think green tea is the best choice of the fluid. Yes. Best choice to drink.
This Wednesday evening, this 24th of the month, 7 p.m., Dr. Qinglong Zhang is going to be presenting an amazing evening. Seriously, it's one, I'm having a lot of fun right now with this topic, but the truth of it is that brain fog is a symptomological representation of things that can become progressively severe in your body. And if you don't get it, you're going to have a problem. You're going to see things deteriorate over a period of time. You're going to see memory loss. You're going to see cognitive patterns that are going to be declining. Your capacity to do things and wanting to do things, your certainty levels are going to go away. The value that you have of who you are as a being also. And we're just talking about the emotional pieces, but these are real emotional expressions based on alterations of neurochemistry, all these neurological signaling components in your body. It allows everything else to work the way it's supposed to work. This Wednesday evening, the 24th, join us, join Dr. Qinglong Zhang, and he'll get into the intimacies of this, and he'll talk about, some of the triggering mechanisms, that come about biochemically, triggering mechanisms that come about structurally, and the emotional components and so forth. Your body recovers from hyperstimulation or constant stress patterns, and all stress causes a diminishing pattern that ultimately causes this brain fog, this foggy head, this anxiety level, this persistent stress pattern that seems to feed on itself. And come and find out. Give us a call, 703-698-7117, or just simply go online to rosellecare.com. That's ROSELLECARE, rosellecare.com. Register for the class. As you know, our classes can be very full, and we have to say, I'm sorry you can't attend. So if you'd like to attend this one, and I think that you should, please register early and do it online or call the office. And if you'd like to talk to us here while we still have a few minutes, it's 888-630-9625. Let's talk a little bit more about the pieces. I'm going to ask you a question I asked you on your very first program.
Yes.
Okay. Is this fixable?
Of course. That's why we are here, right? The answer always the same.
Good answer.
Yes.
Absolutely. No, but the truth of it is you can resolve this, and you can begin to turn things around. I think the point that you're trying to bring out is that...
So, it's just we talked about it before. So, sometimes it's very easy to fake. It's just because you don't know why. And people say, okay, I have many patients come here. Okay, oh my God, thank you so much. You resolve my problem issue in 2 weeks, 3 months, or 2 months. I have been handling this issue for 20 years. Remember last time we have a headache and migraines lecture? I have some patients from their lecture and come to see me. There's one guy have their probably this guy in front of the radio. The one guy have their headache for 20 years. He took Tripertan, he took painkiller, didn't work. Just every week about 3-4 times. Every time it lasted for 1 day, at least 1 day. So the headache is terrible, and he quit the job. He said, I cannot work because the headache. Now since then, I treat this guy, and this guy still come back to maintain his care. And then that guy last week, he told me, I went back to work.
Excellent.
Yes. The only thing is you don't know why. The why. You don't know why.
Well, that's your job to teach them. Let's go to the phones. Ed, how can I help you, sir? I got a quick minute.
Yes, hi, doctor. I was diagnosed with a high calcium CT score last year. I did a scan, and since then I've been trying to figure out supplementation. I was doing calcium magnesium 1-to-1 to cut that out, but vitamin D is a question. I thought I read some stuff that there's a contraindication of vitamin D and calcium buildup in the
No.
Can you comment?
No, if you're taking too much calcium, particularly as a guy, most men do not need calcium. They need vitamin D, they need selenium, they need boron, they need trace minerals to balance it out. You have to have enough hydrochloric acid in your stomach to make sure you get transport of calcium. If your calcium level goes too high without supplementation, then you start looking at parathyroid hormone because calcitonin is one of the things that are produced in the parathyroid gland that transport this. But vitamin D levels, very easy to tell where you need to be. You do a blood work, you want to be somewhere above 50 and you want to be somewhere under 100. And that's good for immunological response, and it's also good to maintain calcium. Anything outside of that, there's other pieces to this. Ed, hang on just for a second. I want to talk about it 1 more minute, and that's all I'll have, but I got to come up to a break, so don't go away. You're listening to Dr. Tom Roselle Live. My guest in studio, Dr. Qinglong Zhang. We'll be right back.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You've been listening to Dr. Tom Roselle Live and Dr. Qinglong Zhang. We've been talking about a very interesting topic of, kind of brain dead. No, we're talking about brain fog, but it's really brain dead and, things that go along with it. Before we get into it, I'm going to wrap it up a little bit. Yep. Ed, are you still hanging in there?
Yes, I'm still here.
Thank you. So listen, anytime a calcium score goes up, particularly with a man, you want to look deeper. First, you look at, are you taking any supplementation that has calcium in it? Men generally, unless there's a very specific reason that you can show on blood work and doing parathyroid exams and so forth, are showing that you're spilling calcium, and you got to make sure that you keep the mineralization levels up. You shouldn't be taking it because it will start plaquing. You increase your risk, even with a 1-to-1 magnesium ratio. You're increasing your risk of forming stones in the kidney and the gallbladder and the like, and coronary blocking and that sort of thing. So guys generally don't need calcium. Your vitamin D level can be very safe. You just want to make sure you're taking a natural form of vitamin D, and on an annual basis, you look at the measure. So before you start, if you're going to start on your own, other than somebody guiding you to do it, you should get a vitamin D level and see what it is. Again, if it is 50 or above, you're in good place, and you need to stay under 100. A perfect marker in my world would be around 70. And your immune system stays strong, and you have enough vitamin D to bone transport. Now, when it comes to transporting calcium, you're still looking at boron, selenium, and vitamin K, K2 particularly, and looking at those things to make sure they're in adequate balance. So you have to make sure you have enough hydrochloric acid in the stomach to be able to transport the calcium. Not enough hydrochloric acid can't transport it. You dry your stomach out, meaning decrease your digestive enzymes in any way, you've got a greater problem. So I hope that's a little bit of a guideline for you, Ed.
Thanks so much. I am taking vitamin K2, and okay, that's very helpful.
Okay, but do the blood work. If I can help you, send me a note, and I will get back to you as best I can, and I'll try to guide you with this. But thanks for your call. I really appreciate it. Dr. Zhang.
Yes.
Tell us what you're going to be doing. You've got a couple minutes this Wednesday evening, and why people should be there with us.
Oh, so sure. I still have a lot of things to share. So I will talk about what's the brain fog, what's the reason cause that from Chinese medicine and a chiropractic perspective, two perspective. So this is why I learned chiropractic. So I will talk about how can we treat that, how can we target their reason and then treat this their brain fog. Also, we will talk about, just like you asked me, if you just keep going and have the patient have brain fog, what's going on there? What's the result? Result is brain on fire. What's the result of brain on fire? I will tell you Wednesday. Okay, I talk about the leaky gut, the SIBO related to the brain fog too. Why? I will tell you Wednesday. So there's a lot of answer, there's a lot of information in Wednesday. So I want to share with you as before. I will give you the tips from the Chinese medicine, because Chinese medicine is very preventative, their medicine. So I want to give some tips to let it prevent you have the brain fog. So we want to do the prevent step rather than do the treatment step.
Interesting you're bringing up some of these points. My dear friend, Dr. Evan Mladenoff.
Yes.
And I had the opportunity to see him this weekend. We were talking about Chinese medicine.
Oh,
because
really?
He and I both, obviously we've been to China and
He's
we've
very
studied it.
Yeah,
he's a very intuitive, very bright man.
It works very well when I was in practice. When in practice now, I use different perspectives. This is why I'm not so popular. So that's why a lot of people like me, because I can use a different perspective to analyze the body. So Chinese medicine is based on their qi level, or energy level, or life force. And the chiropractic is based on the nervous system.
But we were saying, when we were talking this weekend, that Chinese medicine truly is preventive medicine.
Yes.
And the old emperor's doctor, right?
Yes, yes.
His job was to keep the emperor from getting sick.
Yes.
And if the emperor got sick, the doctor would pay for it. We're coming up to the end of the program, unfortunately, way too short as it always is, and we'll be here next week. I think next week is a Saturday, but we'll be seeing you on Saturday. See you then. Bye.
See you. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.